Hey, fellow YouTuber, it's me, John Laval. Listen, I want to tell you a little bit about asthma and the puffers that are available. I mean, right now, pharmaceuticals are producing dozens of them, and I'm an asthmatic, and I never did well on puffers. It's the Ventolin, yeah, sure, it'll open up my lungs, and but this idea that I'm firing this dusty stuff into my lungs just agitates the lungs, and then I've got infections. And I'll tell you something: if you have asthma and then you throw an infection in your lungs, you've got serious problems breathing. And what do? You take more puffers, which adds more of the ingredients that cause the infection, and then you're taking all these other Intol and Beclafort and all these other drugs, and I've been in the hospital just fighting for my life because of these puffers I was taking. And after years and years, I was seeing a respiratory therapist every 4 months, 3 times a year, and he would check me out for lung volume, because that's very important, what your lung volume is. And he was showing me on the charts that the lung volume is depleting. It's getting less and less as the years go on. So I was in the hospital, and they said to me, he had come in, he did the test again, and the doctors came in and they said, your lung volume is below 19%. And I knew the lung volume was really minor, because I couldn't even get up. I didn't have enough oxygen. My oxygen levels were in the mid-80s, which is very, very dangerous. If it gets about 82, you're pretty well done. And it should be about 98, 99, 97 is okay. And so they said, you need to go home and get your affairs in order, because at the rate of decline here, your time's up. So I did go home. I did not get my affairs in order. And what I did is I thought about if I've got lung infections and stuff, what exactly is it that's going into my lungs that would cause these infections? And I got to thinking, it's got to be these puffers. This is a drug that's going into my lungs, and I'm taking 4 or 5 of them all at the same time. And I did all the gargling stuff. You know how you're supposed to gargle so you don't get infections. I mean, they're even stating that the infections come from these puffers. So I did all the gargling thing. It never helped. I basically lived in the hospital fighting for my life. I mean, I was seriously fighting for my life, where I didn't sleep for 3 days with my chest just heaving, trying to get one more breath. I mean, I almost would have paid money just to die than to have to go through that, another minute of that. And so what I did? I threw all the stuff in the garbage. And I went to the doctor and I said, I want some Ventolin nebs, the nebules. That's the liquid form of Ventolin. There's no powder, it's just a liquid, it's a vapor. And I went to the drugstore and told them to get me a Ventolin pump. It's a little machine, a little compressor. You plug in, you get a mask, and you pour the stuff in there. It's just the same as you get in a hospital, but they usually run a line off of an oxygen or an air line. And so this is the same thing, except it's not attached to the wall, it's attached to a small machine. And so I went on to that, and all of a sudden my lungs are opening up, and I'm not dying. I'm doing okay. And then so I was right, it's the puffers. They're no good for your health. Eventually I figured, it would have killed me, As I said, the amount of lung volume was just down to nothing. Now my lung volume's as normal as anybody's my age, and I don't seem to have a problem with that, and the Ventolin I don't use that much anymore because there's no assault on the lungs, because basically this is a self-serving industry. They give you a drug that will make sure that you're not getting better. You stay at the state you are, you're getting worse, which means they sell you more drugs. So that's the way that always is. Anyways, that's what I did. And I don't take any steroids or Intal or anything junk. I'm glad that I made that decision, or came up with that idea of possibly it's the drugs that are doing it. So, anyways, that's what I wanted to tell you. That's what I did, and I feel much better now that I threw away the stuff. Talk to you. Bye now.